Please have a seat.
Thank you.
Are you Mr. Raymond Lopez?
I am.
Hi, nice to meet you.
Nice to meet you.
How are you doing today?
Doing good. How are you?
I'm doing good. My name is Yolisma Rivero. I'm an RN.
Okay.
Thank you for coming to this education session. I've only been doing this for a couple of weeks, but I do have other experience in nursing. I worked for the dialysis clinic. I was a hemodialysis nurse. I've also worked for critical care, and I've been a nurse for 13 years. So this should only take about 30 minutes. And then as you progress, you're newly diagnosed diabetic, so it's going to take a while before you learn everything and learn how to take care of yourself. And I see that Dr. Corbin sent you over. Is he your primary doctor?
Mm-hmm.
And you're on metformin, 500 milligrams twice a day?
Yep.
Okay. So I want to start off with just kind of explain to you what diabetes is. And Dr. Corbin says that you are a type 2 diabetic. And so a lot of people wonder, what's the difference between type 1 and type 2? And the only difference is, there are many things that are alike and many things that are different. But the main thing is that with type 1 diabetes, the pancreas don't produce any insulin at all. And insulin is the hormone that your body produces, that your pancreas produce to help you when you eat food. That food turns into sugar, and then with insulin, it allows the sugar to go into the cell and give you energy. So with type 1 diabetes, your pancreas doesn't make any insulin. It was either an autoimmune, you were born that way, or the person was had some kind of damage to the pancreas, to the beta cells. And in type 2 diabetes, it's either due to insulin resistance, which means your body becomes resistant to the insulin. So, your body I keep saying body, but your pancreas may be making enough insulin, but your body's become resistant. It no longer works the way it should. Sometimes there's also a malfunction where the pancreas doesn't secrete or produce enough insulin for the whole body. And I do have a video here for you. I wanted to show you just kind of the way all that works. I wanted you to see like a visual of how your cells are. So here is your cell, and you can see that when you eat foods, that food turns into sugar and it goes into your bloodstream, and then the pancreas is able to release the insulin, and the insulin then goes to the cell, and it acts like a key to a door. It attaches to these receptors right here, and then it essentially the door opens, and then the glucose is able to go into the cell and give the cell energy. So with diabetes, this is not functioning right here. So the foods that you eat, like carbohydrates, are not bad for you, but what's bad is that the cells are not allowing the insulin to work the way it should, so that the sugar goes into the cell. And so when the sugar can't go into the cell, the sugar stays in the blood, and this is what causes damage to blood vessels and to the organs of your body. And so that's basically how it should work. And the way to treat this is just with there's 3 things that you can do, and these 3 things are exercise, changing the way that you eat, your diet, and also medication. So those 3 things are needed so that a person can manage diabetes well. And so with those, going into that, with exercise, you just want to make sure that you talk to your doctor and let him know that you're going to start exercising, and just follow his recommendation. But it is recommended by the American Diabetic Association for you to exercise 30 minutes a day, 5 days a week. Now you can start off slowly. Start off 15 minutes a day, 3 days a week, and then move up slowly to 30 minutes a day. because it's hard for one person to go from no exercise to exercising every day. And you don't want to set yourself goals that are so high that you can't reach them, and then you just give up,
Right.
But exercise is very important because this is what helps your cells not be resistant to the insulin. So the more you exercise and you start to lose the fat around the cells, then the cells are able to use insulin correctly, and then sugar doesn't stay in the blood anymore. So exercise is very important. And then I was telling you about the diet. With the diet, you either want to do a calorie control diet or limiting your carbohydrates. And that's going to be something you want to be talking to a registered dietitian that can give you more information on what foods are better for you or what foods are worse for you to eat. How many carbohydrates are you supposed to have per meal? And you can just ask your doctor to send you to a registered dietitian. We have one here in the hospital.
Okay.
And the main reason for controlling your diet is also to control the blood glucose level. And then the last one is going to be, the third thing is medications. So with medications, I see that you're on the metformin, 500 milligrams twice a day. Metformin is the most common medication used, and you can talk to your doctor more about how exactly it works in your body. But I do know that it works helping your liver to not release sugar at night. And there's more to the medication, but there are certain things that you need to take care of with this medicine. But the most important thing is for you to not miss a dose of your medicine. Make sure you have a way to remind yourself to take the medicine, either an alarm on your phone, have it on a calendar, on a checkoff list, a daily checkoff list. But it's just important for you to make sure that you tell your doctor if there's a side effect that you notice, because you don't want to just stop the medicine all of a sudden. You want to let the doctor know. You don't want to get to the point where you stop the medicine because of a symptom, and then you wait a month to see the doctor, and then what if, by the time you see the doctor, a complication arises from that. So you want to be sure that you'd let your doctor know of any changes once you continue that medicine. Another thing that's important with medicine, with you, changing your diet and exercising and starting this medicine, your blood sugars can drop. And so I have here a list here on my computer. Let me show it to you. So this right here is going to show you all the symptoms of low blood sugar. And some of those symptoms are going to be sweaty, clammy skin, anxiety, tachycardia, shaky and trembling. And so and sometimes people are very hungry and have headaches. So these symptoms, if you start to have these symptoms, make sure that you have a snack with you, either peanut butter crackers or apple juice, something that's going to help you increase your sugar. Because you're making all these changes, then this can happen, and it can be dangerous if you don't treat those symptoms. If you have a glucometer with you to check your sugar at that time, you should check it. And if you don't have it with you, just go ahead and eat that snack. Okay?
Okay.
All right, so those are the ways that you can manage your diabetes. Like I said, it was the exercise, the diet, and the medications. And now I want to go over to those self-care practices. So these are things that you're going to be doing to prevent complications. Because diabetes itself is not the worst part. The worst part is when other organs are involved, when other organs become damaged, if you don't control your blood sugar level, if you continue to have a high sugar in your blood, that's going to eventually damage blood vessels, organs, nerves in your body. And so one of the main things that you want to do, the first self-care practice, is controlling your blood sugar, which we kind of already talked about how to do that. But it's very important for you to monitor your sugar at home. Do you have a glucometer?
Yeah.
Do you need help learning how to use it, or do you feel like you understand it pretty well?
I think I understand it pretty well.
Okay, so do you have a notebook where you're keeping track of all your sugars that you take, that you check?
I try to, yeah.
Okay, so it's good for you to start off at least once a day, check your sugar in the mornings, but go by what the doctor wants you to do, because for type 2 diabetes, it's not established how many times a week or how many times a day to check it. Type 1 diabetics do have to check it, constantly before they eat food or before their medicine. But for you, it's not really established how often to do it. You just want to make sure that you know where your blood sugar is, because you'll have better control of your own sugars if you know where you're at. If you know, hey, when I ate this food, this happened to my sugar.
Right.
And then that's the main thing, is controlling your sugar is going to be the most important part, because that's going to help prevent complications. Okay. And the next thing, I'm sorry, I have something else here. When you do speak to your dietitian about the foods that you're going to be eating, or the diet, the way you change your diet, make sure that they also it's important for you to learn like this low salt, low cholesterol diet incorporated with either the low calorie or the limiting carbohydrates. Because that goes into our next self-care practice, which would be the blood pressure. You want to make sure that your blood pressure is under control, because those two things, a high blood sugar and high blood pressure, those two things are going to work against you to cause damage. So making sure that you do see your doctor and that you're taking your blood pressure medicine if you have high blood pressure. Now, if you don't have any risk factors of heart disease, like a family history, if you don't have a high cholesterol, then we want to make sure your blood pressure is less than 140/90. But if you do have risk factors for cardiovascular disease, then your blood pressure should be 130/80 or less. So those two things are going to help prevent complications. And the next thing is going to be your feet. So because you're with high blood sugars, the nerves start to become damaged. The feet stop with time. The feet can your feet can lose the sensitivity on the soles of your feet. So here I'm going to show you here another paper here that shows, and I'm going to give you copies of all these, but these show you step by step how to take care of your feet. It's very important for you to take care of your feet, because there is less sensitivity to the soles of your feet. If you say you're walking barefoot and you step on a sharp object, and then that can turn into an infection, and that can turn into a amputation.
Oh wow.
So you don't want to have that happen to you. And so with foot care, the things you want to be doing, if you see here on the computer, you want to inspect your feet every day. You want to look at your feet every day. Look for any sores, any blisters, any calluses, anything that's bothering you. You want to let your doctor know if you have a foot doctor, and you should be seeing your foot doctor at least once a year. You also want to wash your feet really good with warm soapy water and dry them really well every day. You want to put lotion on the top of your foot, on the bottom of your foot, but not in between your toes. Your shoes and your socks need to be comfortable, not constricting, not very tight. Inside your shoes, you want to inspect them for any rocks, for any toys, anything that could be stuck in your shoe. because there's less sensitivity. You may be stepping on a rock and you don't know it until it's created a blister. So that's why you want to check your shoes every day and check your feet every day. It's very important that when you do wash your feet, and that you should cut your nails after you wash your feet because the nails are softer. Now you're going to cut it around the toe or just straight across, and then the edges of your nails, you want to use a file to file it down. You don't want to get the toenail clipper so close to your toe and that you can damage or injure your toe, and then that can turn into an infection. Another thing is to not walk barefoot. Use slippers, house shoes. Always wear shoes when you're outside. You don't want to walk barefoot because you have a risk of stepping on something sharp, and then, like I said earlier, becomes an infection, and then that becomes an amputation. Okay. The next thing on here I have is dental hygiene. So people with diabetes have a higher risk of getting gingivitis and getting periodontitis. Sorry, that's a hard one for me. So those two things can happen with people with diabetes. So you want to just, brush your teeth twice a day, floss daily, and make sure you're visiting your dentist twice a year for the, dental cleaning and exam. The next thing on here is for your eye exam. You want to have a yearly eye exam, a dilated eye exam, because with diabetes and if you have high blood pressure, that can cause damage to the vessels of your eyes, behind the eyes. And so you want to make sure that you're seeing, sorry, do you need some water or something? I feel like, I don't know. Are you okay?
Yeah, we can take a break.
You want to take a little break? Okay. All right. So the yearly eye exam, you want to make sure that you are seeing a doctor once a year, because those vessels behind the eyes can be damaged, and by the time you have these symptoms, it may be too late. You won't have any symptoms. People with eye damage in the back of their eye may not have any symptoms. So the only way to catch that is if you see your doctor. And the best thing to do is just to control your blood sugars. If you don't manage your blood sugars then you can get damage to your eyes. Okay. So the next thing on here is just making sure that you are visiting your doctor, your primary doctor. He's going to be checking your hemoglobin A1C. That's a level that it's a percentage of your blood sugar over the last 3 months. So that has to be done at least twice a year, but sometimes it has to be done 4 times a year. Basically, it depends on how well you're managing your diabetes. So you want to be seeing your doctor at least twice a year. He's also going to be checking at your kidneys, because your kidneys can also become damaged. A lot of people, or many people with diabetes, get kidney disease, and it's chronic kidney disease, and then it can go to renal failure, and then it could go to end-stage renal disease. And like I said earlier, I come from hemodialysis, so to me it's important to sit here and teach patients how to prevent this, because I've been on the other end where, most of the patients at the dialysis clinic were there because of diabetes. It was either diabetes or high blood pressure that caused their kidneys to shut down.
Okay.
So yeah, your doctor's going to be checking to, urine samples, blood samples, to check the function of the kidneys, to check if your sugars are being controlled. He's also going to be monitoring your blood pressure, managing your blood pressure, giving you, your medications for that too. And so that goes to our next self-care practice, is just for you to medication adherence. It's so that you take your medicine the way the doctor wants you to take it. And like I said earlier, if you have any issues with your medication, make sure that you let your doctor know. Don't just stop taking the medicine, because in fact, one of the blood pressure medications helps prevent kidney failure. So it's very important for you to take your blood pressure medicine as well, if the doctor did order it for you.
Okay.
So the other thing I have on here is just basically it's just to do you feel like you have a good support home with your wife, your parents, or do you feel like you have a strong support? Because diabetes is a difficult disease because it's not easy for a person to change from one day to the other. You know, it's something that you have to take step by step. It's a lot of changes at once, and you don't want to do that. You want to start off focusing on the medication, making sure that you're taking it right. Then focusing on monitoring your blood sugar. So then you're doing those two things. And then after that, you know, focus on your diet. You can't do it all at once. And then after you have your diet down, making sure you take your medicine, monitoring your blood sugar. After that, you want to start exercising. So it's just little by little. And the more that you come to these education sessions, you will continue to learn more and, you know, become an expert at taking care of yourself. So just wanted you to know that, you know, you have to take it day by day, step by step. And you also want to, if you have any symptoms of depression, if you feel like this is too much for you, make sure you let your doctor know. There's counseling or even, you know, medication for depression if you do feel like that's an issue for you.
Okay.
Okay, Mr. Lopez, thank you for coming to this education session, and I hope to see you soon.
All right.
All right. Bye-bye. Thank
you.
you. Bye.
Bye.
You didn't say if you have any questions.
I don't want to ask you. I want you to go already. No.
I could not. I could.